Okay, well, welcome everybody. It's good to have you here. It looks like folks are just joining the chat here. So we've got about a number of folks joining. We're really delighted to have you here today and to have this conference. So I'd like to thank Brett, the team at the federal office here at the University of Colorado, the President's office, for helping to facilitate this today. We've got a couple of expert guests with us. Really, the goals today are to try to think about DoD grants, and with the experts that we have here, I think we're going to have a great discussion. Hopefully some questions from you as well. We're going to talk about some of the best practices in this regard, the types of cancer research really that's most likely to achieve funding success with the DoD. So there are some specific nuances to this. I've actually my own research career done some work in DoD, and it's been very fulfilling, but there are some differences from the NIH work that I've done, and we've got again, a chance to talk about that today. So welcome. We're glad to have you here. I'll turn things over to Dr. Schulick.
Thank you, Tom. And I'm pleased to participate in this wearing actually two caps, Director of the Cancer Center, as well as Chair of the Department of Surgery. And we have a lot of activity in this space and look forward to having even more activity. So we're privileged today to have Susan Sweat and Jonathan Miller from Cornerstone Government Affairs to help guide us through programs within the Department of Defense, or the DoD. So I'll start by introducing Susan. She is principal and director at Cornerstone. She guides many education, nonprofit organizations and companies through the DoD application process. She previously served as legislative director for Senator Roger Wicker, Republican from Mississippi, who was on the House Appropriations as well as Senate Arms Services Committees. So she has a lot of experience from that point of view. Jonathan Miller, also a principal at Cornerstone, has more than 10 years managing medical research and development programs and appropriations. Importantly, served as Chief of Staff and Director for R&D at the Defense Health Agency. And we've had a pre-meeting where we've had the opportunity to discuss some of the issues on this campus. And I know that there is a ton of opportunity and many things that we can build upon. So welcome and thank you.
Well, thank you very much. We appreciate the opportunity to be with you today and to talk a little bit about the DoD and its cancer research programs. I think that we have a slide deck that we are going to be showing you. I don't know, Brett, if you have that to pull up.
I'll pull it up in 1 minute.
Okay. What we really want to help you understand today is what the opportunities are at the DoD. I mean, I know that a lot of you are very familiar with and probably primarily funded by the NIH, but the DoD does have a substantial amount of money put towards cancer research programs. So we want to help walk you through where those programs are and how they operate, and help answer your questions about how to achieve success when competing for those programs. So as you are probably, and if we can go to the next slide and the next slide. And the next slide. All right, so the DoD has a lot of different research organizations. The one that we're primarily interested in today is the Defense Health Agency, but you'll see that both the Air Force, the Navy, the Army, which are the services, as we call them, the different services within our military, have their own research organizations, and then there are joint, meaning combining or interested in more than one service. There are these joint agencies that handle distribution extramurally and intramurally of research dollars for the Department of Defense. The Defense Health Agency is where we're going to focus our talk today, and why my colleague Jonathan is so impressive as being the head of the Chief of Staff for the R&D efforts there. Next slide. And I just wanted to give you a little snapshot of how big, when we're talking about research funding. So R&D funding, you see that HHS is there at over $40 billion. And you know that the vast majority of that HHS money is in the NIH, right? So the DoD, has almost double the amount of R&D funding. But that is not all in biomedical research. So we'll talk about that. Let's go to the next slide. And so where is the basic research dollars and how much is there? So within the DoD, they organize themselves into different aspects of R&D, right? We've done a presentation for CU before, and we get into some more granularity on how the DoD organizes itself and what definitions they use for different parts of R&D. We won't get into that today, but suffice it to say the S&T program, the Science and Technology program, is where we find the basic research, and that's where we see most of our universities competing for dollars within the DoD's research and development funds. And so about half of that basic research money ends up going to universities. I showed you those different agencies just before, and you can see below how much money the Army, the Navy, and the Air Force get for basic research dollars. And then the defense-wide is that joint agency money. And then within that, you can see that the cancer programs get a relatively small dollar amount. So we've highlighted that in red. One of the things that you see is that out behind each one of those dollar amounts, you see that that Congress is usually adding more money than the DoD request for this kind of research funding. And that's because your political leaders prioritize R&D, right? In any way that they can. Congress is the one that adds money to the NIH budget much higher over and above what they ask for every year. And they also do the same thing for the R&D budgets of the Army, the Navy, the Air Force, and the broader DoD infrastructure. The cancer research programs in particular are a place within DoD. The DoD never asks for funding for cancer research each year. They produce a budget and they send it to Congress, and it's a request, the budget request. So what you see out there is there are $0 that DoD requests for cancer research each year. All of the money that you can compete for in cancer is generally provided over and above what the department asks for because Congress prioritizes that. And that's really interesting and exciting for a few reasons. It means that well, number one, democracy works, right? And you get to advocate and have your elected officials advocate for things that you're interested in. But it also means that that there's opportunity to see increases in those cancer program dollar amounts over time. So let's go to the next slide. All right. So if the DoD is not asking for cancer research dollars, what are they asking for? Here we summarize the different priority areas that the DoD has determined for their research dollars. You can see that biotechnology is a basic science interest area and is one of the priorities, and cancer does fall within that. But when we talk about the DoD, they have a very and we'll kind of get into this a little bit more, but the DoD is very interested in solving problems. And so each one of these areas, these research priority areas, they've identified as where they have gaps and problems that need to be solved, and are allocating resources to fill those gaps in knowledge to solve problems, whether that's in quantum science or hypersonics or microelectronics, right? These are all places where they see that there is an operational problem that DoD soldiers, sailors, airmen, and Marines have, and they are allocating R&D dollars to solve the problem for those men and women on the front lines. If you're DoD, cancer isn't generally one of those problems that you're looking for. If you're Congress, cancer is one of those other problems that that can affect readiness and your ability to perform your job well, whether it's your own cancer or those of a dependent. So that's why Congress comes in and puts more money into those programs. Next slide. All right, I'm going to turn it over to Jonathan to talk to you a little bit about the medical research focus of the DoD.
Yeah, sure. Thanks, Susan, and thanks to the CU team for having us today. So just want to focus real quick on what we consider the quote unquote core research areas of the Department of Defense when related to medical. So when folks think of kind of the classical work that we would do in support of medical R&D, it really falls under three buckets: combat casualty care, military operational medicine, and military infectious diseases. And this holds true for work that's been done in our various laboratories within the department focused on hemorrhagic shock or en route care, prolonged care, as well as when we consider with operational medicine, psychological health, traumatic brain injury, performance in extreme environments, maximizing human potential. And then, of course, in infectious diseases, obviously that was a critical area for the military over the course of the past 2 to 3 years with the COVID pandemic, but we also had a prime focus on bacterial as well as wound healing, wound infection, wound care, and management overall. Now, this is what we would call the president's budget or core program that would be allocated, to the DoD as part of any annual budget cycle. Now, aside from that, is what Susan had mentioned, where Congress adds specific special interest items that they would like the department to focus on in terms of their medical research activities. Next slide, please. And as part of that came the establishment nearly 30 years ago, I think we're about almost at 31 years at this point, of the congressionally directed medical research programs. So this was really something that was set by Congress with very specific congressional intent, with the first program focused on breast cancer to really address the needs of servicemen and women as well as their families in cancer-based areas or other areas that are outside the traditional department investment positions. So CDMRP in general, they fund innovative, impactful, high-risk, high-reward research. It's conducted all throughout the world, well, with the exception of China at this point, because we've gotten some very specific inquiries about work that had been ongoing in China. But right now it's conducted primarily, it's US, it's international based, a lot of extramural organizations, as well as partnering opportunities with some of the intramural laboratories within the department as well. Something unique to CDMRP, and we'll highlight this a few times throughout the discussion today, is their two-tier review process, which focuses on a peer and a programmatic review, as well as the makeup of those peer review and programmatic review panels, which includes scientists, clinicians, as well as consumer advocates or patient advocates and caregivers that have experienced or have folks that are experiencing specific disease states or injury patterns and conditions. And really the overall goal is to try to accelerate the advancement of medical research, try to accelerate the closure of military medical capability gaps, and highlight specific breakthroughs that can be made in terms of supporting warfighter health and readiness, as well as caregiver and families and other beneficiaries across the military health system. Next slide. So what I want to highlight here, again, I mentioned established in 1992 with a small budget allocation to support breast cancer research. And the program over the course of 30 years has really morphed into not just breast cancer, but ovarian, lung, prostate, rare cancers, pancreatic. So really a wide variety of cancer spaces, as well as other injury patterns and disease conditions such as traumatic brain injury and psychological health. There's a focus on multiple sclerosis, Alzheimer's, autism, etc. So right now, I think they're up to about 33 or 34 different programs that have specific resources allocated to them. And then over the course of the past 30 years, nearly $20 billion has been invested in medical R&D in these specific areas across the Department of Defense. As you can see, over 20,000 awards, and they're still going through the negotiation process to close out fiscal year 22. Next slide. So here is just a snapshot of the programs that received congressional funding in fiscal year 23. We've highlighted here the specific cancer-based programs. You'll notice here a large bolus of funding of $130 million supporting the peer-reviewed cancer research programs. When I was with the department and working with CDMRP at that point, when the program was initially started, I believe it was about 15 million. So that has really increased in size. And there you'll be focusing on cancers that don't have specific program allocations. So brain cancer, bladder, stomach cancer, thyroid cancer, those types of activities. And then really new in 2020 came the rare cancer program. And the way that the department defined that was anything that had 100,000 cases or less per year. Those were investments they were making in terms of rare cancer. One of those happened to be pancreatic at the time. That has since been pulled out and been made its own separate program at $15 million per year. Next slide. So here is just an overview of the programmatic cycle, and we'll kind of discuss in subsequent slides about some material differences between DoD and the Congressionally Directed Medical Research Program and the NIH model. So really, this kind of starts with the congressional appropriation. So say, for example, in fiscal year 23. From there, if it's a brand new program, CDMRP will host a stakeholders event where they'll bring in scientists, clinicians, advocates, et cetera, from not just the military, but from the civilian community as well, to really kind of set an understanding of what the capability gaps are in any specific disease state, injury pattern, or condition. From there, they'll form a programmatic panel, which will used to be called an integration panel. Now it's a programmatic panel that will kick off a vision setting meeting. And this really kind of sets the stage for how any one given program will execute, whether it's new or if it's an existing program, on an annual basis. So this really sets the strategy for what's going to happen with those resources and with the program over the course of that fiscal year. Again, the panel is made up of clinicians. Yeah.
Then if I could jump in here.
Sure.
Yeah, I just want to point out to our participants that when the CDMRP programs were created, one of the first things that the DoD did was go to the Institutes of Medicine and ask them how to set up a program that doesn't duplicate NIH's efforts. Yeah. And this is an IOM recommendation, this two-tiered process that involves the programmatic panel. And the programmatic panel, as Jonathan just said, is a key feature of this program that I just want to drive home for you, in understanding that there are people that are not on the DoD that are from academics, with academic backgrounds, with research backgrounds, with clinical backgrounds, and then patient backgrounds, and their caregivers that sit on this panel. It's a really important thing to note. It's important to know who's on that panel. We'll get into that more, but I want to underscore that as he's giving the overview, because it matters when we come back to it later.
Yeah, it's a great point to make, Susan. It's a good point to make now, because one of the factors that we were consistently kind of fighting against in the department was, how is this not NIH? How is this not duplicative of work NIH is doing? So, as part of that, we did institute the IOM review model of this two-tier process, but also had to account for how the work we were investing in was not duplicative of the work the NIH was investing in. So it's a very good point. And in terms of the programmatic panels, I will highlight that there are opportunities within any given fiscal year for folks from the CU community, for example, to serve on peer or programmatic review panels to really understand kind of the operational context of how these programs are executed and resourced. And a great example of that is Dr. Vic Babarda from the CU Center for Combat Research actually serves as a chair for one of the CDMRP programmatic panels. So just to kind of keep that in mind as we move forward. So from the vision setting, again, setting the strategy. So say, for example, a program has $10 million. That panel will make the determination on how many funding opportunities should be released, what those funding opportunities will look like, whether it's a pre or postdoctoral award, a consortium model, clinical trial, et cetera, and then how much should be allocated to a specific award mechanism, whether it be, $2 million for $400,000 or $500,000 awards, et cetera. So that all comes out of the vision setting. From there, funding opportunities are released, and you'll be asked to submit a pre-application or a letter of intent. There are notable differences between the two. Pre-application actually does get reviewed by a panel. A letter of intent is just an administrative document that's used for CDMRP to make determinations of peer review panel makeup, et cetera. If it's a pre-application, it gets screened. You're invited to submit a full application. From there, it'll undergo scientific review. And then following that, it'll undergo a programmatic review. We'll get again and again to the two-tier review process, so I won't highlight it here. But the output of that programmatic review is a funding recommendation that then gets approved, moves on to award negotiation, award management, et cetera. The general timeline for this type of activity from vision setting all the way to award could be anywhere between 12 to 24 months. Next slide, please. So just in terms of information, I know sometimes there could be a little bit of heartburn in terms of, what is it that the DoD is actually seeking? How do I get information? What is this enigma that is DoD medical research? CDMRP and the department have really done a good job in terms of providing transparency to the work that they are looking for, the outcomes of research that have happened, and really just the history of the program. So there are various program pages on the CDMRP website. There's one for every single program that they execute that highlights what the appropriation is, the programmatic panel makeup, recent applications that have been recommended for funding, really kind of highlight the solicitations, the general application instructions. And there's also links to various webinars too for folks to become a little more educated and ingrained in the CDMRP processes. Next slide. So just delving a little bit deeper into kind of the transparency that they have before a funding mechanism is actually released, they will release a reference table of award mechanisms. Again, that'll highlight eligibility, the mechanism elements about whether it's a partnering PI option, whether clinical trials or clinical research is allowed. It'll give a feel for what the funding is going to look like, as well as the potential periods of performance, whether it's 18 months all the way up to 4 years. And then it'll also highlight the application deadlines as well, and it'll have links to the specific award mechanisms too. Next slide. So after all of this process and planning and writing applications, et cetera, it doesn't go into a black box, right? So CDMRP is very transparent about the number of awards that would be made, the competitive spirit associated with their programs. They will highlight, what occurred for each mechanism, the total amount allocated, et cetera, how applications scored. Applicants, for example, will receive a summary statement that has a peer review score, and they'll be able to see how folks evaluated their application. One thing to highlight, and this will come about on the next slide, or I believe it's the next slide where we talk the two-tier process, is, and this is a material difference from NIH as well. Once an application is submitted, there is no communication with peer review panels. There is no communication with programmatic review panels. So you can't pick up the phone and call a programmatic panel member and say, hey, how did my application score? You can't get feedback from a programmatic review either. Basically, the only thing you'll get is a summary statement, and then you will get an award letter of whether you are funded, not funded, or you're selected as an alternate. Next slide. So we've talked a little bit about the funding mechanisms and opportunities available. I know this was, probably of interest to folks, whether it's, these large, robust awards, but really it kind of shoots the whole gamut of pre-doctoral awards that could be up to $75,000 over the course of 3 years, all the way up to large consortium models that have ranged anywhere between $5 to $15 to $20 million over the course of 5 years. So, when folks are conceptualizing, or programmatic panels are conceptualizing through vision setting, they look for deficiencies in programmatic balance and say, hey, we already have a large, robust consortium model, but what we lack are clinical trial capabilities. There's some, emerging therapeutics that may be coming out. Perhaps we should, set a strategy to fund 2 clinical trials this year as part of the program. So as you can see, it really is across the entire continuum of concept and exploration hypothesis development awards that could range from $50,000 to $150,000, all the way up through consortium models that can be anywhere from $10 to $20 million. So it really is contingent on, what the feel is from the program, awards that they've made in the past, and the success of those awards. Next slide. Here is just some sketch work about the application review process. We've already highlighted this in terms of, submitting a pre-application and a full proposal. The system that's used is a system called eBRAP. I don't think anybody would have any difficulty navigating that system. Everything is codified as part of the general application instructions that CDMRP uses for their program announcements. So next slide. So here we go with some of the material differences between CDMRP and NIH. And keep in mind, this is, my view and Susan's view of things that we've seen over the course of, a decade or more. I don't want to date myself too much. So with CDMRP, the first thing is there is congressional intent. CDMRP will not deviate from that congressional intent. If the focus of an appropriation in a program is to look at triple negative breast cancer, that is going to be the focus. That is going to be their premier focus that year. It's subject to change on an annual basis. It rarely does change unless there is a problem associated with the program. The congressional intent typically comes out when a new program starts. So for example, with spinal cord, if I recall correctly, that program started in 2008, 2009. We haven't seen any change in congressional intent since that time. Consumer participation. This is what Susan mentioned. It's the opportunity for patients, advocates, the academic community to participate in all facets of the award cycle. So that's the vision setting and stakeholder engagement meetings, all the way up through the programmatic panels and making award selection and recommendation. So CDMRP's model is very keen on ensuring that patient and caregiver voices are heard as part of their peer and programmatic review processes and in setting the strategic vision, associated with the program. Now, of course, CDMRP is very clever. They realize that these patient advocates and, consumers, et cetera, like Susan mentioned, are the ones that are going to advocate for more resources in subsequent years to support their program efforts. So just keep that in mind. Specific focus areas.
Jonathan.
Yeah.
Yeah, I'll just jump in here for a second and
Sure.
say, one of the things, just to say it very explicitly, the programmatic panel, when they're making their funding decisions, does not have to follow the peer review score only. They do not fund down the slate like the NIH does, right? So your peer review score is really one little piece of this, and that's why that programmatic panel is so important, because they're the ones using that peer review score to inform their decision. But when they have limited dollars, they're not going to, just because the peer review scores were high, put all of their money into the same concept, idea, molecule, or mechanism. So it's we keep coming back to this programmatic panel, and it's very important because peer review scores don't rule the day like they do over at NIH.
So that's a great point. And it's a great point because in years past, when I used to serve on programmatic panels, for example, the only thing I would see is a peer review score. They would not issue summary statements to programmatic panel members because they didn't want us reevaluating the science. What they wanted us to do was focus on how this nested in addressing capability gaps, how it addressed programmatic balance across an entire portfolio, what was the military relevance. That's the focus of the programmatic panel, but the programmatic panel are the ones that have the final say, thumbs up, thumbs down decision on whether something gets resourced or not. So it's a great point to make that programmatic panels are not reevaluating the science. They have a score as a metric and then they move on. Now, of course, we challenge that for some things and we're able to, see summary statements sometimes, but, it depends on how much of a fight you want to put up. I would like to highlight this is an annual award cycle. So for example, at NIH, there's 3 opportunities, right, across a given fiscal year. The solicitation opens and it closes. And if you miss the window, you got to wait till next year. So there is 0 leeway in if it's due at 11:59 and you submit at midnight, it's late, it's non-compliant, it doesn't count. So keep that in mind. And then the other thing is each award is unique. So there are no renewals of awards. There are no recompetes of an existing award. The one thing that CDMRP has done in years past, but it's subject to the review panel and it's subject to what happens on any given fiscal year, are expansion awards. So if you're a previous DoD award recipient, you were successful, they may offer in a subsequent year an expansion award that could be competed for so that you can continue on with your work. But once that period of performance is closed, there is no renewal. So just something to keep in mind. Next slide. So this really, to me, is the biggest difference. And I know we kind of keep foot stomping this activity related to the two-tier review process. So each year, the programmatic panel will get together and they will write the specific peer review criteria that's going to go into the solicitation. It's part of the vision setting process, whether it's, feasibility, whether it's, clinical trial design, whether it's the intervention to be studied, et cetera. And that gets a score based off of scientific merit. The outcome of that is a summary statement from the peer review panel. Things then move over to the programmatic review panel, completely different set of metrics for how proposals are evaluated. They're evaluated with the scientific score as just one criteria, but it's primarily adherence to the intent of the award mechanism, military relevance, and programmatic balance across the portfolio. So as Susan mentioned, you could get a 1.2 as a scientific score, but you could get a 4.0 in programmatic because it wasn't militarily relevant, or it didn't necessarily adhere to the award mechanism, or they have 50 proposals that are doing the same thing and they want to shake the system up a little bit and diversify what the programmatic composition is of their portfolio. Next slide. Susan, I don't know if you want me to take strategies for success or if you want to do that.
Sure, I'll jump in here, Jonathan, and you can clean me up a little bit.
That's good.
But I think we have hammered these into your heads by now, but just for fun, we're going to keep going after it. Relevance. You need to be reading the pre-announcement that comes out, the announcement when it comes out, and really making sure that your narrative addresses those goals that the program has. Those were not pulled out of the sky and they will be held to, right? And so you need to be able to articulate how relevant your work is to those goals and how that will have a further impact in the program. As part of that, of course, and I mentioned this earlier, the DoD is not an entity that is focused on science for science's sake. That's how they're very different from the NIH. They're identifying places where there are gaps in knowledge or treatment, and they are trying to close those gaps. So you want to make sure that you're explicit about how your proposal will take us another step closer to that. And then, of course, you want to be within keeping of the limitations of the program, right? Make sure that that you are suggesting collaborations that are within your power to execute, that you have the resources accounted for and available to access in your proposal, right? You have to have a very technically sound plan and don't need to gloss over that. And a note here that collaboration, and we'll talk about this in a second, is something that we can also help you with sometimes if there is a relevant military collaboration. We can go to the next slide. And of course, these kind of things aren't very different from the NIH, right? Your timeline needs to be tight. You need to have thought through your plans and have a clear understanding of what your coordination needs to look like, and your grantsmanship needs to be there. There is the programmatic panel. You do have to fit into the overall goals, but you have that peer review score, and you have to be clear and have a well-written proposal in order to see success. I can't emphasize enough the deadlines and the requirements. We do have clients that get tripped up when they are putting in perhaps a letter of intent. Different programs have different ways of doing pre-proposals or letters of intent, and we'll have clients that get tripped up on putting those in. Some of those are optional and some of those are required. So you really do need to read through the solicitation and understand where your deadlines are, and be operating, a good 48 hours ahead of those. Next slide. So as we've emphasized, focus on program goals, but you can also socialize your research. So Jonathan pointed out that that after your submission is in, you're not going to be able to engage the programmatic panel. However, before your submission goes in and before there is actually a call for proposals, it's a great time to be engaging with programmatic panel members. There are great opportunities for dialogue if you are at conferences where you'll see some of those. It's worth spending some time on the CDMRP website and getting to know your the program that you're going after, and looking at your programmatic program panel participants from previous years, and if you know them or have a connection, maybe reaching out if they are out in academia or industry. Those are great places to learn a little bit about how the program panel worked in previous years and how it's likely to work going forward. But there's, also opportunities at conferences, whether those are civilian or DoD, to engage with folks that might be on that programmatic panel, so that you can learn a little bit more about how they're thinking as they move forward. And of course, an opportunity to serve on one of those programmatic panels, and you will see calls for nominees or for those interested in serving as a program on the programmatic panels or as a reviewer. Both of those are fantastic opportunities to get to know the program a lot more, and to achieve some success in it. Next slide. And so how do we help with that? Well, we can, if you're interested in going after one of these programs, we're happy to just jump on the phone and give you some advice and talk about your engagement strategy. We can also help you get to know people on the programmatic panel for some of these, introduce you to the program director at the appropriate time, right? Not when there's a call on the street or when you're being reviewed, but there is a sweet spot, in there when we can make introductions. And if you are in one of those programs that has a specific interest in service members and their cancer treatment or survivorship, I think that there are lots of DoD collaborators that could potentially work with you, and that can also help potentially increase your receptivity on the programmatic panel. So there are centers of excellence at the DoD for several different types of cancer, and we're happy to introduce you to the folks in those centers of excellence. Oftentimes there's interest in working with the military hospitals. These are, we call them MTFs, military treatment facilities, on clinical trials and other parts of research. That can be quite difficult. The hospitals don't actually get their own R&D money, and we just don't know what to do with it. So we can help you with that a little bit if that's of interest, and make the appropriate introductions for you there. And then as you're putting together a proposal, whether that's a pre-proposal or a full proposal, and you have some military relevant language you'd like us to review, we're happy to help with that as well. Next slide. And I think we're now at the point where there's just questions. So we are, I think there's been some that are already put in the chat. One of those was about, can you receive the same award multiple times? And certainly, the awards change a little bit from year to year. There's no prohibition for getting funded by the same program year over year. Jonathan, I don't know if you have anything to add to that. I mean, there's some.
Yeah, I mean, I guess, kind of depends on the context of the question, right? So, there's no prohibition, say, this year, if someone has a platform that is, would be useful for breast, ovarian, lung, for example, multiple, cancers. There's no prohibition from that investigator applying to all of those programs, right? What I would say is what we would do in the DoD, if after 5 years you want to reapply, change the title a bit, right? Because we would look at that and say, well, this looks like the exact same award that they were just funded for. But if it's something to progress the field forward from your prior award, that's different. There's nothing from having somebody submit, say it's the breast cancer program, from submitting 3 investigator-initiated research awards, for 3 different ideas, right? There's no prohibition. And we would consistently triage with our contracting folks what pending support you would have, what active support you have, et cetera.
We have another question in the chat about breast cancer, and we will be sending around the slide deck. So you will have this, and you can have the list of all the funding levels. But breast cancer, yes, is the #1 funded. It's worth noting the program was started with breast cancer. Congress does not generally dictate to the NIH how much money they spend on different diseases, and that's been a gentleman's agreement going back many decades. And in the 90s, Senator Harkin from Iowa, his wife was diagnosed with breast cancer, and he wanted to do something about it, dang it, and couldn't add money to NIH for breast cancer, so decided to add it to the DoD for breast cancer. And that's how we started with the congressional, with the CDMRPs. So breast cancer is still the top funded. The prostate cancer is up there, very close to breast cancer. And so it's just the general peer-reviewed cancer research program. Let's see. And we're happy to take live questions too. Another question coming in on the chat is a pre-application mandatory. You'll see in the call whether or not that pre-application is mandatory. There are some programs that use a letter of intent, an optional letter of intent. There are some programs that have a mandatory pre-application or a non-mandatory pre-application. When it says it's strongly recommended, treat that as mandatory, right? Don't think that you're so great that you can, that your program is not going to need that pre-application. So another question about the VA. So the VA has a very different system than the DoD. To receive VA research dollars, you have to be a 3/5 employee there. So you have to have a shared appointment. And so that is really a PI to PI kind of arrangement that you have to make with the local VA. And I know that you have some of those relationships in Denver. And so when you're, the question is how do you work with the VA? How do you be a VA investigator? And then can proposals be combined? Certainly, if you are doing work with a VA population and think that there's some additional support that the DoD can provide to that population, I would not say these are programs that be combined with the VA, but if there are aspects of your research that make for a compelling additional project that happens to work well with your already funded project with the VA, that's worth noting.
Hey, Susan, there was one real quick about pediatric cancers that I found really interesting. And I'm not sure if the application was submitted through the DoD or not, but the pediatric and adolescent cancers are covered through the peer-reviewed cancer research program as opposed to the rare cancers. And CDMRP has codified a specific definition of what they look at in terms of rare cancers, and it's on the webpage, and we can provide that if of interest.
Susan and Jonathan, I have a couple questions for you that came in earlier, and some of these are related to eligibility, so I'm going to bucket these together. Are there, can postdocs apply, training awards, postdocs, and does DoD allow for multiple PI applications, multiple principal investigator applications?
So eligibility criteria is dependent upon the award mechanism. So, for example, there are the breast cancer program has released in prior years pre-doctoral and postdoctoral awards. There are some other programs that have done that as well. But each award mechanism has its own specific eligibility criteria that folks should be aware of, whether, it could be a new investigator award where you have to be, no more than 2 to 3 years removed from your postdoc. It could be early career investigator is another mechanism that they use. Or it could be, they call it an IIRA, Investigator Initiated Research Award, where sometimes they want you to be at the assistant professor level or above. So each award mechanism has specific criteria for eligibility. In terms of multi-partnering PI, most mechanisms allow for up to 4 partnering PIs to collaborate. So it really, again, is contingent on the actual award mechanism.
Thank you. I have one other one that's come in earlier, and that is, what about patient-reported outcomes and quality of life type of proposals? Are those funded through the DoD?
Yeah, it depends on if the programmatic panel has prioritized those, right? So there are some places where you will see that, but pay attention to where the focus areas are. I don't think, we're saying this over and over for a reason, right? If there are absolutely some CDMRP programs that where that is a high priority and is seen as a gap that is necessary to address. There are others where that is not seen, and I'm not thinking specifically in cancer, but like, for instance, in ALS, I think is one where that's not prioritized. I might be missing that, but that is a robust debate that happens in the programmatic panel. So pay attention to what they actually put in the directive.
Great, thank you. And I saw a question come in that asked, how do we find help for these applications? And I just wanted to address that really quickly. And Brett, if you could go back to the previous slide, I want to talk about just very quickly how people can work with Susan and Jonathan to help them with their applications or help them with their strategy around their applications. And so that process you can see on this slide, you have an opportunity to submit. It's a very simple form, should take 10, 15 minutes to fill out. Submit your ideas if you are interested or think you have a proposal idea that could align with the DoD. If you submit it to this form, you see a link there, and that goes to Brett, who's kind of behind the scenes here, and myself. And then once we have these applications, we'll take a look at them with Jonathan and Susan to identify which of these best align with where the DoD is headed right now in their priority areas. There isn't a due date specifically set out for this, but we will follow up in a follow-up email. We anticipate about 6 weeks, mid-February, to have these in, so then we can work with Susan and Jonathan. And we hope to fund a couple people to, a couple applications, 2 to 3 maybe, if there's good alignment that can work with Jonathan and Susan to think about your research strategy and how to move yourselves forward. If there's any questions, you can contact Brett's information is on this, his email, as well as mine. I'm Laura Buccini, and again, Brett's behind the scenes. So any questions about this process, working with Cornerstone, DoD specific questions about mechanisms, please feel free to reach out to us. And Tom, I think as we're wrapping up, Susan, Jonathan, do you have any last minute thoughts, advice that you want to share with this group?
I just note in the chat where Dr. Merrick is talking about being the chair of the lung programmatic panel. I mean, these are great opportunities. Reviewing, being a reviewer and being on the programmatic panel are really great opportunities to get plugged into these dollars. And so in addition to all the stuff we've talked about for making your grant a success, I think more than anything, getting involved in the program, as Dr. Blake can talk about, is a great pathway.
Yeah, maybe a few more minutes too. There's a few I see that just popped up in the chat. So, maybe we could take, if Laura, that seems reasonable, just 3 or 4 minutes to address some quick ones, Susan and Jonathan. There's a few that just popped up. Or do you think we've covered all the things to chat there?
So a couple things just to highlight real quick. There was a mention just about quality of life real quick. Alzheimer's specifically releases quality of life based program announcements. But for example, in last year's prostate cancer announcements, one of their overarching challenges was focused on quality of life. So the award mechanism may not explicitly say it, as the title of the award mechanism, but, it could be an overarching focus area. So just something to keep in mind.
There's what about advocates, inclusion of advocates on applications? I don't know if we touched on that.
So it's happened in the past. I think it was with the ovarian cancer program. It was a bit quirky.
That's not a usual feature. It's not what I've seen.
Yeah,
maybe on that programmatic disease specific level.
Yeah, it was a bit quirky when that happened. Trying to kind of marry up that contract was a bit different. Volunteering to be a member of a panel. No, it's not limited. There are specific criteria. All that is outlined on the CDMRP website. We've discussed the contact, lung cancer. We've addressed that one.
Maybe got most of those, huh?
Yeah, it looks to be.
Well, okay, let me just do this then. In terms of wrapping up, I want to thank Dr. Schulick for his welcome and coordination on this in the Cancer Center. I think it's a great opportunity for us. I want to thank Jonathan and Susan for your expertise and understanding your background, your work in this. I think it's a real asset for us. Special thanks to Laura and also to Brett and our federal relations team at the CEO President's Office for facilitating this and so forth. We will have this recording. We'll make that available. And again, I think that Laura and Brett are both available for follow-up things. So, Rich, you want to make any final comments?
No, thank you to all. And, the other thing that we can kind of do offline is see maybe how we compare to other peer institutions. There may be specific areas that we're missing on looking at their portfolio and our portfolio. And I don't know if there's an easy way to do that, but maybe that's something we should do. Thank you all.
Thanks, everyone. Have a great day.
Thank y'all.